Thank you, and good afternoon, everyone. And today we are reporting 13 new cases as well as 6 additional recoveries. Most of the new cases, again, are in the Loche and surrounding areas, and we continue to provide significant resources and make every effort to work with community leaders in Loche and throughout the north to control the spread of COVID-19. And again, I want to take this moment to thank everyone involved in this effort for the great work that they are doing in dealing with what is a very challenging situation. Today, Statistics Canada released new numbers showing the economic damage and the job losses this pandemic has caused on provinces across the nation. And of course, there have been huge job losses everywhere as a result of the measures that have been taken to control this pandemic. While the new unemployment numbers are very troubling, and we are concerned about each and every job that has been lost in this province, there is also reason for just a little bit of optimism in these numbers. From February until April, the number of people working in Saskatchewan dropped by 12.7%. That is a huge number of jobs lost, and this is very concerning. But it's actually less than any other province in Canada. Every other province has seen a higher rate of job losses than Saskatchewan. Saskatchewan's unemployment rate is now at 11.3%. And again, while that is very high and quite concerning, it is also the second lowest unemployment rate in Canada. The fact is that Saskatchewan is weathering the storm better than many provinces. In February, there was 570,000 people that were working in Saskatchewan. In April, that number was 499,000. That's 71,000 Saskatchewan people who have lost their jobs due to this pandemic. And we need to find a way for those 71,000 people to safely go back to work. And at the same time, we should recognize that about 500,000 Saskatchewan people have remained employed throughout this pandemic. And that is good news for all of us. And it shows that people can go to work in stores and in public services as well as other workplaces, and that we can do so safely, while at the same time controlling the spread of COVID-19. Of course, we know we are all doing things a little differently at work today. Many of us, for instance, are working from home. All of us, hopefully, are physically distancing, and we are washing our hands more often. And today's job numbers show that most of us have been able to keep working while we have been able to control the spread of COVID-19. And that is good news, because it has sometimes seemed all too often like it has been some sort of binary choice that we are being asked to make in this province and in this nation. Do you want to reopen the economy, or do you want to control the spread of COVID-19? Well, the fact is I want to do both. We all want to do both. And I think everyone in this province most certainly does want to do both. And together we will. We will reopen the economy, and we will bring back these jobs, and we will continue to control the spread of COVID-19. I firmly believe that we are able in Saskatchewan to achieve both of these goals. We can continue to keep our friends, our neighbors, and our families safe, and we can gradually reopen the businesses that have closed, so that our friends and our neighbors who have unfortunately lost their job can start going back to work. That's the goal of the Reopen Saskatchewan plan. So today, we added reopening dates for a couple of more types of businesses. Drive-in theaters, for example, can reopen on May the 15th. Farmers markets can open on May the 19th. Like many other businesses, they will have to follow a number of protocols and guidelines to keep their employees as well as their customers safe. All of the protocols and guidelines for these and other businesses that are being allowed to reopen can be found in the very comprehensive Reopen Saskatchewan document on the government's COVID-19 website. There are still a number of businesses that will not be allowed to reopen when Phase 2 starts on May the 19th. So today we are announcing additional support for those businesses. The Saskatchewan Small Business Emergency Payment Program has already provided payments for up to $5,000 to small businesses that were required to close or to severely curtail their operations due to COVID-19 and the subsequent response. If your business was already approved for the initial payment of up to $5,000 and your business is required to remain closed or continue to substantially curtail their operations after May the 19th, you will automatically receive a second payment. You do not need to reapply. And to date, we have processed more than 4,600 applications, and we have provided in excess of $15 million in support to Saskatchewan small businesses. We want to support those small businesses so that everyone has a job to come back to when they are able to reopen. So with that, I just want to say thank you once again to everyone in this province for what you are doing to reduce the spread of COVID-19. And I want to encourage each and every one of you to continue your physical distancing practices so that we can protect not only yourself, but your family and friends. So I'll now turn it over to Dr. Shahab for a few opening comments.
Thank you, Premier. So I will go over some of the numbers and then a couple of updates on outbreaks and Mother's Day. As the Premier said, 13 new cases, 12 are from the far north, all from the Loche area, and one from the north region, Lloyd area. Rest of Saskatchewan is very quiet in terms of COVID-19 activity, and that's good. 6 more people have recovered, and we understand, as we looked at the table on the website, that because most of the cases in the northwest are recent, they will take a week or two to come out on the other side as recovered. We are tracking very closely our hospital census, so there are now 19 people in hospital, and that's something we're tracking very closely. It is high, but it is being driven for the most part by 6 hospitalizations in the north, primarily in the Lloyd area, and 2 from the far north, and the remaining 9 are in Saskatoon. 4 are in intensive care, 3 in Saskatoon and 1 in the north, in the Lloydminster area. So again, like we discussed yesterday, hospitalizations and ICU admissions are a lagging indicator. That's not what we need to track, but we can see that whenever there's an outbreak like in Lloyd Hospital and whenever there's a community outbreak like in Northwest, we do see a bit of an increase in hospitalizations, which we are seeing today. In terms of other information that's in the news release, we can see that 192 cases are in the 20 to 39 age range, more than other age ranges, and 72 are 19 and under. So in the past, the fact that there were more cases in the 20 to 40 age range was primarily because they were more likely to be healthcare workers or involved in other essential services like grocery stores. But now we are seeing an increase in that age group primarily due to the outbreak in the Northwest, and that's why we keep stressing that it is important for all of us to maintain the discipline of physical distancing, not mixing within households. And while most of us now in Saskatchewan can form virtual households very carefully with 2 additional households or 2 additional friends, and that can't apply right now in situations facing an outbreak where you do unfortunately have to limit yourself to within your household. And while that can be very hard for young people, it is essential to manage the outbreak. 44 cases now in healthcare workers, and this is just a reminder for us that people at the front line, healthcare workers, fire, police, ambulance, EMS, other essential workers, step forward when all of us have to stay home, especially during an outbreak, and then there are an increased number of cases in these essential workers, including healthcare workers. And we all need to do our role to keep ourselves safe, but also keep our essential workers safe as well. Our death numbers remain unchanged at 6 deaths, and Minister Reiter yesterday mentioned the sobering statistic that the vast majority of deaths have been in long-term care residents, and in Saskatchewan, 2 out of the 6 were in long-term care residents, so a third of our deaths have been in long-term care residents. I just wanted to go over some clarification around how we will be reporting outbreaks. On the website, we already now are reporting outbreaks, and we will be updating that. And you will have to bear with us if there's a few hours or a day lag. So, for example, if you go to our website right now, it says there's an outbreak in Lloydminster Hospital, start date April 29th. Victoria Hospital, it was declared May 1st, end date May 7th. And Meadow Lake Hospital declared May 5th. And then it also lists outbreaks in integrated facilities like La Loche Health Center and community-based outbreaks. So there may be a bit of a lag on when this gets updated, but that will be a transparent way of notifying outbreaks in hospitals, integrated care facilities, and community outbreaks where the public has a right to know, and it'll be posted online. And I just want to also emphasize that, for example, when there's just one person in a acute care facility like Victoria Hospital or Meadow Lake, the initiation of an outbreak investigation starts to make sure that there's no further transmission either in staff or patients or visitors. And so that is concluded in Victoria Hospital within 1 week, and the outbreak was ended. It's still ongoing, that investigation in Meadow Lake, but it's just limited to one person. So just because an outbreak has been declared doesn't necessarily mean that there's lots of cases. It just means that there's a focused investigation and some enhanced protocols in place to make sure that A, any additional transmission is detected in a timely way, and B, specific provisions are put in place to further restrict transmission in those settings. Beyond that, we will obviously announce outbreaks in personal care homes and homeless shelters and other settings like corrections where there are vulnerable populations. And as you know, 3 weeks ago, there was a single staff person in assisted living facility, and that was announced as in Regina. And then there's an additional second staff person 3 weeks later, but that still has not progressed further. But that's also in part due to the existing procedures that have been strengthened around staff cohorting and mask use and limitation of visitors, but also enhanced protocols that are put in place whenever there's an outbreak. In other venues, such as small private workplaces, there's also when there's someone who may have acquired COVID-19 in the community but works in a small workplace, public health always will investigate those settings. But if it's just limited to a few employees and there's no impact to the public, those outbreaks do not need to be publicly announced. It's just an investigation that's done as a matter of routine. But if there's a situation where members of the public may have been exposed and can't otherwise be traced, then there is and has been in the past and will be a public service announcement that again will be as part of a news release and will be posted on the website. And public notifications will also happen when there's no outbreak, but there's a concern that there may have been exposure to the public. In the past, we've done that with things like measles. If a child with measles went to an ER or went to a public venue, and we'll continue obviously to do that with COVID when there's evidence that there may be risk to members of the public who can't otherwise be contacted. So that's just a bit of a summary on outbreaks and where we've moved in terms of posting outbreaks. But we would request your patience because there may be a few hours lag between what's online and what's being reported through social media. Other venues, it's really hard sometimes to be consistent, and especially in this day and age where through other means information is available. And then we got some inquiries around Mother's Day, obviously very important for those whose parents and mothers at this point may be in hospital, long-term care facility, or assisted living. So the SHA has made some protocols for that, which include that, especially during visitor restrictions, which limits the ability of families and loved ones to gather or connect during this time. There may be an opportunity to send gifts over the weekend, and the SHA has determined that flowers from a florist and dry paper gifts that are not an infection risk can be sent, and that includes purchased floral arrangements and dry paper gifts such as cards, letters, books, pictures, artwork. Floral arrangements will not be permitted in some acute care settings, such as intensive care units, due to possible allergies in staff or residents in those settings. And facilities are expected to follow existing processes to receive deliveries in a manner that reduces the risk of potential transmission by minimizing traffic in and out of the facilities and practicing appropriate hand hygiene. So there is an opportunity to send gifts to family members and, for example, mothers over the weekend, but following some specific guidelines and precautions. So that is my update for today. Thank you.
Thank you, Doctor. We now have about 25 minutes or half an hour for questions. We'll go to the floor for our first question, staff.
Yeah, to the Premier. Is it acceptable that some community leaders, residents, those working on the front lines of dealing with the COVID-19 outbreak in the far north are voicing some concerns and experiencing shortages of supplies? Is that acceptable?
What kind of supplies are you referring to?
There's been some reports that some hand sanitizer, there was a grocery store that was closed in the Loche, and there's been concerns voiced about how that's going to be
Sure.
impacting residents there.
Well, with respect to the supplies, we've seen supply shortages in weeks gone by in many communities across the provinces. People have went out and in those instances for different reasons. We've seen grocery stores that have run out of certain products in many communities. We are seeing some short-term, and I would classify them as very short-term supply shortages. And Marlo, you may have something to add on this specific to Loche in the way of some cleaning packages that have been put together, I believe, by the Public Safety Agency to be dispersed in the community of Loche. We see, I believe, one of the grocery stores has been closed for a short period of time to undergo some sanitation, as there was, and correct me if I'm wrong, Doctor, but I believe there was one positive case identified in one of the grocery stores in Loche. And this has occurred in a number of other places of business as well as public healthcare facilities, and it's part of our aggressive approach, if you will, of testing, contact tracing, self-isolating those that may be involved with a positive case. So I believe that if there are any very short-term shortages of any products, that the Public Safety Agency, particular to our Northwest, the Public Safety Agency is working very closely with the community leaders in ensuring that those supplies can be brought in a very short period of time. And my understanding is where that has occurred, that there has been requests made that the Public Safety Agency has worked very hard to ensure that be the case. Marlo, would you have anything to answer or to add to that?
Thank you, Mr. Premier. I can just mention really quickly that the information that I received just a few hours ago is that, like you stated, there are short-term shortages. The cleaning supplies that the SBSA is rolling out will be in the community today, and I was also advised that the store, unless something goes sideways, the store will be open again tomorrow, and we continue to get deliveries up for the store in regards to cleaning supplies and the critical food.
Follow-up, Steph?
Yeah, Mr. Premier, can you confirm that your government was asked in about mid-March to restrict travel to the Northern Saskatchewan Administration District? And if that was the case, I mean, why did it take upwards of a month before those restrictions were announced?
We did work closely with community leaders. Our minister is in, I would say, discussion often, individually and as groups with a number of northern leaders on how to restrict travel in and out of the north, how to ultimately, where we landed at the end with an actual public health order restricting travel, and now actively having the government take over, or actively having the government man the checkpoints along with other entities like the RCMP, CSOs, and obviously our conservation officers. We've worked hand in hand with the northern communities all along. Have they all been unanimous in when and how we act? No. But we have been working in close consultation with northern communities, starting with they themselves having checkpoints into the north and in and around each of their, or many of their individual communities. But as we saw, even up to and including this past week, when we passed the original public health order restricting travel into the Northern Administration District, there were still a few communities that were not quite at that point yet, L'Orange and Stony Rapids. We've seen even in the past week that has changed, and now all communities are covered under the public health order. So the work that we have done with respect to restricting travel in and out of the north, and now restricting travel between the communities and enforcing that public health order has been done in conjunction with communication with the communities for a number of weeks now, through dating back to the beginning of our address to this pandemic. Have the decisions been unanimous among all communities as we've worked through that? No. But we most certainly have been communicating with them at regular intervals throughout this time.
We'll take our next question from the phone line, operator.
We have David Baxter with Global.
Hey, Premier. Yes, there's been a lot of commentary recently just saying that the current outbreak in the north is just highlighting so many historic and systemic institution shortfalls when it comes to service delivery in northern Saskatchewan. What lessons are you taking away from this, and what do you think might be done going into the future to try to help shore up some of these issues that have been long brewing in the north?
Which issues would you be referring to?
There's basically some of the difficulties, access to healthcare, being able to retain healthcare workers in the north, other social services, things of that nature.
We've been working very hard. I'll speak just specifically to the community of Loche, but also in a broader context in communities right across the north. We've been working quite hard over the last number of years on just those types of issues. I can recall being in the community of Loche in a previous role that I played as a Minister of Advanced Education, working with the community on not only how are we going to offer post-secondary opportunities for that community, but how are we going to offer every opportunity for our kids to finish their K-12 studies, and looking at opportunities to expand the industrial arts program, for example, in the community, and looking for examples or opportunities for them to actually carry some of those credits out of the K-12 system into a post-secondary environment. We were up there with leaders from Northlands College, from SIIT, as well as from Saskatchewan Polytech, working very closely with the community. And we also discovered at that point in time that we were having a challenge recruiting teachers into the community. So we undertook a joint venture with the community on building some housing units, using some of the local individuals in the community so that they could have some hands-on experience in the carpentry trade and building some of the additional housing units that we would need to recruit teachers from across Canada, quite frankly, into the community of Loche. But then we also had a conversation about why can't we train some of our educators that are from the community, right here in the community, to continue to educate our next generation in Loche. And that was where the advent of the DTAP program came from, the Denny Teacher Education Program, which is alive and well, and I believe will have a number of graduates. Unfortunately, not a graduation ceremony this spring due to this pandemic, but we'll have a number of graduates that will be completing that program very soon. And I commend each and every one of those individuals that have undertook that four-year program, and ultimately and hopefully will have the opportunity to teach and to practice their career right in their community of either at the Loche School or the Clearwater Denny First Nations High School. So with this is an issue. Services and attracting people to provide those services into our northern communities has been a long-standing issue, but it's one that this government has taken very seriously. And I just provided one example of where we have taken a very active role in working with a specific northern community, and we've done it with a number of other northern communities on addressing some of the local challenges that they may have, whether it be housing, whether it be housing to attract career people into their community to provide services, or whether it be providing education support to train our people that are from our northern communities to continue to offer those services in our northern communities.
Follow up, David?
Just yesterday, Dr. Shahab was saying that he feels it would be possible to hold a fall election. Since the decision's really yours at the end of the day, are you planning on having Saskatchewan people go to the polls in October?
Yeah, October 26th is the planned election date, and as Dr. Shahab had stated yesterday, we are in the process of reopening our province. We have had 500,000 people, roughly, that have been working in our communities throughout our approach to this pandemic, albeit we're doing things very differently today, and an election on October 26th is likely going to look very different than the last election looked like 4.5 years ago. So the plan is to go to the polls on October the 26th, and the full expectation is, and I have every confidence that our Chief Electoral Officer will ensure that we are able to conduct that election in a very safe manner across this province.
We'll take our next question from the room here, Arthur.
So we've been hearing that people congregating in Loche in groups, including kind of young people drinking, has been a major factor in the transmission of this disease. This is for the Premier and for Mr. Pritchard, I think. what is your plan to get through to people, either through further enforcement, through further communication efforts, or through closing the liquor stores, that to actually get a handle on this problem?
You're right. There's a number of, Marlo, I'll make a few comments and you may have something to add. There is opportunities for us to continue to communicate with those that may not be physical distancing in certain communities. And I think this is a reminder for all of us in this province that if we let our guard down for just a moment, how quickly this virus will spread from person to person in our communities, no matter whether you're in Loche or Estevan or Esterhazy. This virus really is indiscriminate in who it spreads to. But we do have opportunities in the way of enforcement. We have a number of public health orders that are in place, and it would be our expectation that the RCMP are looking through a phased approach of education with individuals that may not be following the public health orders and ultimately leading up to enforcement. That is one point of access where we have to educate individuals, again, not only in Loche, but anywhere in Saskatchewan and Canada. There is opportunities as well for Saskatchewan Health Authority to continue educating individuals in the community. As I said before, we have gone on to the 4 northern radio channels, the northern radio channels in 4 separate languages to communicate to people of all ages the opportunities that they have and how to physically distance effectively, as well as the public health order, communicating with them the public health orders that are in place. I would say this with respect to specifically to the youth in Loche. The numbers that we have say that the young adults are predominantly the ones that are contracting COVID-19 in the community and in surrounding communities of Loche. I won't speak to exactly why that is, but if the lack of physical distancing and just not being entirely careful with the sharing of different items and the ultimate spread of this disease, this virus, is the challenge. I would ask them to have I would ask them to stop. I would ask them to take their personal responsibility to physical distance from their friends very seriously, not only to keep themselves safe, but you have many elders in the community of Loche that are very special to you. They may be part of your family. They may be part of someone else's family. And with 82% of the fatalities that have occurred in this nation in long-term care centers, this disease, when it comes to the seriousness of how this disease operates, it is discriminate. It does affect our elderly. It does affect our elders in our communities, and it does affect the elders that we love in our family. And so I would ask the youth in Loche to take their personal responsibility very, very seriously. And I would ask them to pay attention to how to properly physical distance, how to protect not only themselves, but to protect the elders in their family, the elders in their community that I know they love and cherish so very much. Marlo, would you have anything to add to that?
Thank you, Mr. Premier. The only thing I'll add is that the SPSA and a number of different ministries are in constant contact with the leadership in Loche and those communities, and we work with recognizing that this is an issue. We also have staff embedded in their emergency operations center, which is part of that community, and we are doing again working with that community to educate them, and the RCMP are doing the best that they can to enforce that, and we will continue to ramp up as we need to as part of the SPSA in regards to resourcing and working with the local leaderships to ensure that there's an understanding of the importance of social distancing. Thank you, Mr. Premier.
Follow up, Arthur?
This is for Dr. Shahab. I'm just not sure that we've gotten a clear answer about how hospitalized cases are categorized in the tables that are provided there on the website. Is it by the location of the hospital or the address of the patient? And can you confirm how many of the total hospitalized patients province-wide are from the Loche or at least from the far north?
Yeah, so we will be improving that data flow because I think there's a bit of a discrepancy in which how we in the ministry were counting hospitalizations and how they would be counted in different parts of the SHA, because we were just counting ever hospitalized. So once you're hospitalized, if you transfer from one part of the province to another, we were not recounting that, so we had a lower number. And in the SHA, of course, the daily bed census is for a particular hospital or part of the province. And so when you move from one hospital to another, you have one less hospitalization in that hospital, but one other there. So we will be improving that. And the reason we need to improve that also is that, like I said yesterday, that hospitalizations overall in ICU is not our primary indicator to keep an eye on the curve, but it is a key lagging indicator. Hospitalizations happen 2 to 3 weeks after exposure, and maybe for most people, it's a mild illness and people recover in 2 weeks, but if you are going to get hospitalized, it usually happens on day 6 to 10 or 14 of your illness. And then, if your condition worsens, it may be 3 weeks into your illness when you require ICU admission. But then, fortunately, many people who require ICU admission, while they are critical, they do recover and may go back to an acute care ward and then go back home to complete their recovery. So while most people who self-isolate at home recover in 2 weeks, once you go to hospital, it can be just a few days in hospital with some oxygen and back, or a few days in hospital, then a few additional days in ICU, then back to acute care, and then home again. So it's a difficult indicator to track for all those reasons, but we will be doing a more reliable indicator on a daily basis, which will track overall hospitalization and ICU overall, and like you said, by the area of residence, because that is something we need to keep an eye on as well. For example, to track, we do expect to see some increase in hospitalization from the northwest of the province, but right now, because the outbreak right now is mostly in younger people, we think that will be lower. But of course, like the Premier said, whenever you have an outbreak, you always have a risk of secondary transmission to those more vulnerable elders, people with underlying risk factors, and so we want to be able to track that more closely as well.
Just for the second part,
Yeah.
what is the actual number of people who are hospitalized that have their primary address?
Yeah, so as of today, and this is just information I received about an hour ago, and so we'll need to confirm, but as of today, my understanding is that there are 2 people who are in hospital that are from the north, likely from the Loche area. Yes, the far north. And then there are additional 6 people who are in hospital from the north, out of which 5 are from the Lloydminster area. But we need to get better and consistent data and clarify some of the different ways in which the SHA counts for very different reasons and the way we count and report in the ministry.
We'll take our next question from the phone line, operator.
We have Alicia Bridges with CBC.
Hi, thank you. We've started hearing from people in Saskatoon who are sick with COVID-19 symptoms, and we're told by the health authority that they will be contacted to arrange testing. But one has been waiting for 5 days, and another says that they have recovered but were never contacted in the end. My question is, what delays are there with people being contacted for testing, and how can you be contact tracing effectively if there are delays to getting tested?
So, and I may ask Scott to speak to this, but my understanding is there is currently no delay and no lag in testing, and we can follow up for more specifics about individual situations. I do know that sometimes when a person has been named as a close contact, if their symptoms are mild, because the false positive rate may be high, when your symptoms are mild, there may be a request to watch for 2 or 3 days, and if symptoms go away, there may not be a need for further testing unless you are in an institutional setting or a workplace setting. But if the symptoms worsen, then the test is more reliable in terms of a true positive and not missing infection when it actually is there. But I'll just confirm from Scott if there's any specific issues in Saskatoon.
So not that we're aware of, but we certainly will follow up with the team and find out, because we will be able to track if there were delays, and we'll actually look into them, and if something has happened that's untoward with respect to our processes, we will fix them, but haven't heard that at all, to your point about testing and or assessment centers. No delays.
Follow up, Alicia?
Yes, please. The Saskatchewan Union of Nurses says it was, quote, taken aback when it learned that nurses who volunteered to go up north to deal with the outbreaks in Livingstone and Loche will have to self-isolate for at least 14 days. So the union says nurses working with COVID-19 patients elsewhere have not had to follow these restrictions because PPE has mitigated that risk. So that's raised concerns. Proper PPE is not in place in these two communities. Why weren't nurses told about these restrictions earlier, and why are the protocols for these northern nurses different?
We'll refer that to the SHA on the line.
Scott, would you,
Yep. Susan, do you want to take that question?
or Susan?
Yes, this is Susan Shaw speaking. So we did receive questions from Sun, and we are following up with them directly. There is absolutely adequate PPE and processes in place to keep staff safe. And we do know that there is no direction or need for a staff member, including a nurse, who's been providing direct care to a patient with either COVID or presumed COVID status to be self-isolated. There were very specific medical health officer orders in place that were very specific to certain staff at a specific point in time that are not generalizable to all nurses or all healthcare workers, and we'll be following up directly with Sun later today.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi, I'm just looking at some of the changes that were made to the reopen plan, some changes to some of the guidelines, some new guidelines. I'm just wondering, where did these things come from? Was it consultation with business? Are they coming to the government and saying that these things aren't going to work for them?
I'll make a comment. Dr. Shahab, you may follow up from your perspective as the Chief Medical Health Officer, but many of these changes are driven. Let me begin with this. No one has ever had to reopen an economy before, so we are finding our way through this, driven by public safety and proper public health, if you will, in our communities. So Dr. Shahab's and his colleagues, as well as the Saskatchewan Health Authority, have a role in any of the original recommendations that we make, but also with any of the changes that we make to our Reopen Saskatchewan plan. The changes often are precipitated either from the healthcare side or from the business community that is contacting us through our business response telephone line, and providing, in many cases, providing suggestions as to how they can operate better, not only from their perspective, but in a safer manner, in offering either the business service or offering a recreation service or in many cases religious services safely to people in our community. So quite often the suggestions are coming through the business response line from businesses that are operating in our communities. They come through a process where public health looks at those, and we ultimately make a decision with respect to how we move forward in the safest manner possible. But Doctor, would you have anything to add to that?
Thanks. So, yes, like the Premier said, this is, we are moving to a new normal, and we are applying what we know of the way COVID-19 transmits. So we already know that it transmits when you are less than 2 meter distance and there's a cough, or one person is ill, either knowingly or unknowingly, and coughs, and you less than 2 meters distance, and then therefore there's a requirement for PPE, where service has to be provided less than 2 meter distance, and in phase 1 there are medical and allied services that are reopening. In phase 2 there are other personal care services that are reopening, so specific directions for them. But we have to remember that PPE is just one of the things that have to be in place. It starts with screening, so you shouldn't go to seek a service if you're sick, if you have to, for example, go for an eye exam, or once 19th May comes, if you made an appointment to get your hair cut and then you're not feeling well, you must cancel, you must not go if you're not feeling well, and that's responsible for us. And then the same applies in the work setting, that you must not go in an essential workplace or in future other allowed workplaces if you're unwell. And then in settings such as, for example, now that we are allowing in areas without an outbreak, we are allowing ability to make virtual households. For example, 2 or 3 friends can get together 2 or 3 households can get together. So that needed some changes to how guidelines will be interpreted if you're fishing or on a boat where you don't necessarily have to be from the same household, for example. So there's some of those adjustments. And then, of course, drive-in theaters, cars will be parked 5 meters apart. You don't want people jumping from one car to another or handing things back and forth. And I think it'll be a very different environment. So the reason is to allow both some activity outdoors, recreational, in a safe manner, business and economic activity in a safe manner, where physical distancing is maintained, things are not handed back and forth as much as possible, but at the same time doing it in a phased methodological way that minimizes the real risk of a resurgence of COVID-19, either in the summer or in the fall. So basically those are, if you go into the details, it's just in some cases adjusting some of the recommendations. And of course we have to recognize that the leaders, while public health and public safety agency can give their best recommendations based on the science, the leaders in terms of implementation are the business owners, because they know their business, and many have already started thinking about that, okay, given my floor plan and how customers come, what's the best way that I can maintain physical distancing and keep my customers safe as well as myself and my employers safe. So actually they are the leaders in developing, as we have seen in current essential workplaces, that commercial activity and retail activity is continuing in a very safe manner, and we have not really had any major issues so far in those settings where people go and shop in terms of transmission.
Follow up, Lisa?
Yes, you talked about the plan being slow and methodical, and some of the changes that have been made to the reopen plan are for things that haven't even really started yet, like less time between tea times for golfing, changes to how merchandise can be handled in retail operations that are going to open in a week or two here. So is it a good idea to be kind of loosening these restrictions before we really even have a baseline for what the original ones, the effect they might have on the numbers?
I wouldn't characterize this as loosening restrictions. In many cases, it's being able to provide all of the services and all of the opportunities for Saskatchewan residents. In the case of golf, to have the opportunity to go to the driving range, for example, understanding that the balls will be disinfected between the uses. So if the industry, the golf courses, have come up with a solution as to how to offer that service, but to ensure that it is being offered safely from a public health perspective, we most certainly have no reason to not allow those individuals to experience that, whether it be the driving range, the putting green, or whether it be the case, the suggestion that came from many, that when you are fishing, it may not be necessary to have someone only from your household on the boat, understanding that you can practice sufficient physical distancing when you're on a boat, and so you should be able to expand to that broader household dynamic that we have spoken about for a number of days here now when you're out fishing. So these are suggestions often that have come from individuals that are utilizing the service or the business service that is being provided, or the industry or sector of the economy themselves. And they've come forward with what I would say are very innovative solutions quite often that are very realistic from those that are offering or utilizing the service. And quite frankly, it just may not have been things that we have had time to think about as we've gone through the initial framework of the Reopen Saskatchewan. And really, as we said, this is a framework, and we're going to continue to work with all of those that contact us through the Public Service Agency or the Business Response Line to, if these services can be offered and offered safely, we're going to have a look at that. If we don't feel, or Dr. Shahab and his team don't feel that they can be offered in a safe manner, then we have to delay those until a later point in time. So this has been a good thing, I think, a good experience for and a good quality of the plan and the framework that we have in place, the Reopen Saskatchewan plan, where we are listening. We're listening to all of those involved, but at the end of the day, the plan is guided by public health and public safety, ensuring that we are reducing the risk of the spread of COVID-19, not eliminating the risk, but reducing the risk of the spread of COVID-19 and keeping as many people in this province safe as possible, but also allowing us to start to reopen the economy and allow those 71,000 individuals that may not be working right now the opportunity to go back to work.
We'll take our next question from the phone line, operator.
We have Mark Smith with CTV.
Yes, Regina is down to 2 active cases, and the southern Saskatchewan hasn't seen a new case in about 10 days. What insight do you have, Dr. Shahab, in why physical distancing measures have worked so well in this area of the province?
So I think as long as we can maintain a relatively reliable rate of testing, which means that anyone with mild symptoms should go forward for testing from all over Saskatchewan, I think it is very gratifying to see that we have, for the most part, suppressed and as far as we can see, for the next little while at least, eliminated COVID-19 transmission from the vast majority of Saskatchewan geography. And I think that is, extremely reassuring, and I think the credit goes to all of us in practicing in a very disciplined way for the last 2 months. In fact, practicing to a fault physical distancing, that while gatherings of up to 10 were always allowed, people are very reluctant to get together and meet their close friends and family. And in fact, because that obviously has some negative impacts on our well-being and health, we then had to say that you can and should make virtual households, but that means the same 2 or 3 friends getting together, the same 2 or 3 households, not mixing it up and being because that still would be a higher risk, and also being comfortable that when you are getting together, if there are people within your virtual households who are older or have underlying risk factors, just being a little more thoughtful about that as you get together. But certainly that has allowed for this relaxation in our social interactions, but also remembering that because COVID can come back with a vengeance, and within days it can go from 1 case to several dozen, to within 1 or 2 weeks to several hundred. We still, as we reopen and socialize, we still have to, for the most part, maintain that discipline around physical distancing overall. And I just want to add to the previous comments that would still apply that as other sectors reopen, just as grocery shopping is not the same as it was before, make a list, go and pick what you want, put it in the cart, and come home. Similarly, as other retail sectors open, we did get the feedback about significant restrictions that were changed around trying things on and so forth, and returns, because the risk from fabrics and other things may be lower. But still, this is not the time to try 10 shirts on to buy one. I think the best way, still, the recommendation is, if you want to go and get a shirt, you know your size, you go and select your color and then pick that shirt up and come back. And, some days when you go to a retail outlet, you can see the return counter is busier than the checkout counter. And I think it's up to all of us to really be thoughtful for ourselves, for the business, and for other potential customers, that you want to minimize returns, while obviously there was a need to level that off in terms of while you can return through mail order, but why not in a business. I think we really need to change how we engage in retail and be thoughtful for ourselves, for the business owners, the things they would have to now do to make sure that things can be restocked or not based on a return, and also for future customers as well. So we do have to change our practice to a significant degree to allow this reopening of the retail sector, for example, in a safe manner.
Follow-up, Mark?
Yes, with this 2020 CFL season in jeopardy, the City of Regina could be unable to pay off the expected $3.3 million this year for the construction of Mosaic Stadium. How does the province plan on handling that, as well as how will the cancellation of the CFL season impact the province financially?
The Minister of Finance, I'll answer the second question first. The Minister of Finance was out a couple of weeks ago and had discussed some of the revenue shortfalls that we may be experiencing as we progress through the next number of months into the course of the next fiscal year. Understanding that we are only about a month into that fiscal year, so it's very early days, and we've seen, for example, the energy price bounce around a fair amount over the course of just even the first month of this year. So the revenue impacts to the province will be large, but I would say there's also some fairly positive news that has come out just today in the fact that these impacts seem to be affecting Saskatchewan, although at a very serious level, likely the most serious of my generation's experience. It seems to be affecting Saskatchewan to a lesser degree than some other areas of Canada and maybe some other areas of North America. Specific to the CFL, to my knowledge, we haven't had conversations with the City of Regina specific to the repayment of the stadium. And we'll have those conversations as the days progress. The large gatherings, such as going to Rider game to watch them be successful in each and every game, in particular those against the Calgary Stampeders, may not be on for the foreseeable future. That will have an impact not only to the City of Regina, but it'll have an impact as well to the broader provincial economy, and could potentially and subsequently have an impact to the league. And we have if not the strongest, one of the strongest organizations in the CFL in our beloved Saskatchewan Roughriders, and they need a strong league to compete in. So I know they've been in discussions through Minister McKenna with the federal government on some of the resources that the CFL may require to continue if they are not able to proceed with a full season or even a modified season this year. And not specifically the CFL, but the Saskatchewan Roughriders have been a staple of our provincial community for 110 years now, and I just have not even thought of what what an environment would be like going forward without our professional football team. So we're supportive of where the Saskatchewan Roughriders and the CFL are in their endeavors to ensure that we have a strong league so that we can continue to have a strong organization here in Regina.
We'll take our last question from the room here. Arthur?
So it turns out that there's no central compilation of data from the SHA about the current location of people from Loche that they've reached through contact tracing. Like, we don't really know in a centralized location where these individuals are, whether they've moved, whether they're still there, whether they've gone elsewhere. First of all, I was wondering if perhaps Mr. Pritchard might know that, might have some idea of the kinds of movements that are going on inside the community and outside the community, how effective the checkpoints are right now. And then for the Premier, does that concern you that we don't have that information in a centralized way, that people might be going to PA or North Battleford?
Yeah, I'd maybe Scott Livingstone or Marlo, if you have comments on centralized contact tracing and how our contact tracing works, but a centralized database, if you will, on where individuals are. I know other nations, not Canada, but have looked to apps and digital tracking of individuals, of which doesn't comply with the Constitution, to my understanding, here in this nation. But with respect to people moving in and out of the communities, it's our understanding that the checkpoints in a large part are up and operating 24/7. I believe there may be a few that are not exactly at 24/7 right now due to a few different reasons, accessing individuals on those checkpoints. I believe we have a few individuals that have been exposed as part of contact tracing and are being tested, as well as many in the community are. So we are confident that our checkpoints at this point in time are quite effective in limiting the movement, both in and out of the north, but also in and out of and between communities in the north. And we'd ask people to comply with not only the checkpoints, but the spirit of the public health order and the legality of the public health order, as it is what allows us to flatten the curve in all communities. We've proven that. We talked about the numbers in some other areas. If we go back to the very early days of this COVID-19 pandemic, Regina was an area that we were quite concerned about. We were able to flatten the curve in Regina to the point where we are down to 2 cases here now. That was not, Regina was a point of concern, much more so than Saskatoon in the early days of this pandemic. We have proved time and time again, whether it be in a healthcare facility, a long-term care facility, or a community, that we can flatten the curve when we take our physical distancing very seriously, our personal responsibility to physical distance, when we limit our movement between communities and within the community, and we're seeing that firsthand in many Saskatchewan communities, but we can control the spread of this virus. We do that through proper access to testing, ultimately contact tracing, which Scott or Marlo may comment on here as well, and then ultimately providing the opportunity to isolate so that we can isolate not only individuals but isolate the virus so it doesn't spread to additional individuals. So I'm confident in what we have in place. I'm also confident that we'll have ongoing discussions with Northern leaders through Marlo and the Minister and others on if there is additional steps that need to be taken, we'll take them.
You have a follow-up, Arthur?
Well, I think Scott might have a comment on this.
Yes, so I'm going to start, but then I'll ask Susan to add. But I just overall about contact tracing and the targets we're setting for contact tracing. If contact tracing, to the Premier's point, wasn't working, we wouldn't be seeing the results in the south that we are. With respect to Loche and contact tracing inside the Loche area, it's one of the reasons why we've escalated our processes with respect to going door to door, doing harm assessment, risk assessment for whether or not folks can isolate themselves, and then putting in supports through Marlo's organizations and others to ensure that we can properly self-isolate folks. I'm not sure with respect to, if the question is, do we GPS track by using contact tracing? No. Contact tracing, as you can imagine, relies on those individuals to return calls when we're following up non-in-person, so that's one of the challenges. But we are very, very happy with our results to date with respect to contact tracing and believe that we're actually doing a very good job of it, including in the north where we're seeing most of the cases right now are cases that are being transmitted from COVID-positive patients inside the community. They're not coming from outside the community. But Susan, do you have anything to add?
Yeah, so in terms of the hospitalized patients, the SHA can track and follow where patients are in terms of initial presentation, admission, and then transfer. And that's one of the reasons why our data looks different than the data reported by Ministry. Ministry is the organization responsible for surveillance and reporting at the population level, and we do our data based on where patients present and then hospital utilization, because that's the main purpose of the way we do our data, and that explains some of the discrepancy in data. That being said, we have a very collaborative approach, and we do use contact tracing, an application called GoData that does allow for pretty amazing demonstration of social network analysis and being able to identify and trace back and help support excellence in contact tracing. This requires ongoing partnership with both NISA and Indigenous Services Canada because of jurisdictional roles and responsibilities in terms of who holds the data. Of course, the data belongs to the people, and it's important that we are mindful and respectful of all the principles, particularly of OCAP and other things that need to be front of mind when we're working with First Nations and Métis communities, people, and nations. But we do have excellent partnerships and are building data sharing agreements to build on the good data sharing that we already have.
Arthur, I would just maybe take this a step to a little bit different view as well, as this was a topic of the conversation we had not only on the Council of Federation call we had yesterday, but the First Minister's call, and to take our contact tracing efforts and to maybe have start to discuss some degree of standardization, if you will, not only across the nation, but as we go through the next number of weeks and months, understanding that we have a very global and integrated economy. In particular, the Canadian economy is very integrated with our largest trading partner, which is the United States of America. Now, that border, for all intents and purposes, is closed today for travel outside of essential travel, and it should be, and it is likely closed for the foreseeable future. But understanding as we start to open up areas and sectors of the Canadian economy, and they'd start to do the same at some point in the U.S., that there will be some additional required travel, not in the days or weeks ahead, but in the months ahead between Canada and the U.S. And it stands to reason that not only are we able to have a solid system of contact tracing within each individual province, but we need to have some protocols in place, and the time to have that discussion about those protocols is today on what is not only travel within our communities in our province, not only travel within our nation between provinces, but ultimately travel that may extend outside of Canada, coming back into the nation. So this is new for all of us in whatever role we play, but the conversations are happening on how do we bring this together, how do we bring this tighter so that we can continue to track those and get in contact with those that we need to get in contact with to ensure that in the case of international travel, they are self-isolating for their 14 days. To ensure that in the case of interprovincial travel, they know that that may not be recommended aside from for these particular essential reasons. And so this is continues to be a work in progress, but I am quite proud of where we are in Saskatchewan with respect to our contact tracing and how it is helping us really flatten the curve and has helped us flatten the curve in the vast majority of communities.
Follow up, Arthur?
Yeah, because I don't think that I really was talking about GPS tracing or these things that would necessarily violate privacy rights.
Right.
What I'm wondering is through the contact tracing that we are doing, whether it's through phone calls or through emails or through any other method, we must be tracking the current kind of location of those individuals who have been in outbreak zones. But it doesn't seem like the SHA has any idea where those people are now that they're tracking in a centralized way. So I'm asking why not, and why can we not tell people how the total number of those who have come from outbreak zones that are currently in other communities?
Maybe I'll just give a quick update on that. So anytime that a case is identified, the case is followed up by public health on a daily basis. Still, in the vast majority of cases, the person recovers after 2 weeks and then is free to go about in terms of out shopping, or if they're an essential worker, they're able to go back to work. Contacts are also followed up actively by public health, and then if you are a contact, you are to stay home on self-isolation for 2 weeks, and if you are well at the end of 2 weeks, you're then free to go about if you're an essential worker or if you have to go out shopping and so forth. But for those 2 weeks, there are some restrictions, and public health does follow up on that. Obviously, once you are no longer a case or a contact, you are free to go where you want. But having said that, we do not encourage as a recommendation non-essential travel between communities, and that's now also an order for the north. But even in the south, if you want to go for a walk, go in your neighborhood. Everyone shouldn't have to drive and walk in the same place, and because that itself creates crowding. You should not, of course, go shopping if you are a contact. You should ask someone else to get your groceries, for example, and that's the reason for community cohesion, to support people who may be having to self-isolate as a contact. And of course, if you're a case and are unwell, you have to stay home, and even within your home, you have to isolate. So those are all the ways in which contacts are followed up. And yes, sometimes it is hard to find, like Scott mentioned, sometimes you may not be able to find a contact, and public health will then persist. But the ability of public health to trace all contacts, even when there's an outbreak, is very high. It's in the high 90s. But it sometimes does take some time to find a contact in some situations.
Scott or Susan, I maybe just add, I think what Arthur also is referring to is we do have a centralized list, I think, of individuals that have tested positive, but the contact tracing may be a little bit more of the contact tracers themselves have their individual lists in public health that they're following up with, but I don't think we bring that together, all of the list of the people that we are identifying as being in contact with someone that's been positive with COVID-19 into a centralized list that we could look at any point in time. I think that might be a little bit of a more dispersed list out to the people that are actually on the phone and in public health and contacting the individuals on a daily or every few days basis to ask questions as to whether they need to be tested, whether they're symptomatic, are they still, and then the second piece would be their locations, where they actually are. And I'll have a comment after, but I think that's more direct to what the question is. I don't know, Scott or Susan, if you have any comments on that.
Yes, Premier, I think you're correct in that, in how you've answered or clarified that answer on our behalf. I think that though, and we can follow up to close the loop with Arthur on this, but I do believe that the Go data application that we're using internally to manage contact tracing does give us that capacity. The most important thing is that the public health teams locally are doing the contact tracing that's needed to be done locally to manage and prevent and protect the population.
Dr. Shahab?
Yeah, so I just want to say that there is a bit of a lag in that numbers being consolidated because, like it was mentioned, each local public health unit works with the case and then they generate the contacts. Ideally, you should be able to name your contacts within the household, obviously, but outside the household on one hand. But if the contacts are larger, they may not reside in the same public health unit, so then that information has to go to other public health unit to find the contact and then follow them up. And we have to remember that, for example, and there's a 1 to 2 week lag on this information, but for example, out of our cases, there were well upwards of 2,500 contacts that are generated, and on average, a case can generate anywhere from 2 to 15 contacts, and we want to see that number as low as possible. And obviously, if you live in a smaller household and haven't been going out at all because you were physically distancing for the last 2 months, your number of contacts will be low. If your household is larger and you have 2 or 3 other households which are virtual households that are also large, even though you're not getting together in a gathering of more than 10, the number of contacts can be 10, 15, 20, so it starts getting quite, complex. But it is a dynamic number, and it takes a few days for that to be consolidated, so there's always a bit of a lag. But certainly we can continue to share that. The range and number of contacts can sometimes, in some settings, be quite large. And ever since we restricted mass gatherings, that did come down. But now in a community outbreak setting, sometimes that can be very challenging.
I would just say, in addition to the very effective contact tracing that is happening here by our public health officials, I cannot understate the personal responsibility that each and every one of us have in ensuring that we are practicing good physical distancing. This has proved successful to us, not only in protecting ourselves, but in protecting those that are elderly and those that we love in our family and in our community. And I had said a few weeks ago, I was asked, what do I think about each and every morning when it comes to our response to COVID-19? And each and every morning I wait for those numbers to come in, and I cross my fingers and I pray that there is not an additional fatality. And proper physical distancing prevents that. And it has kept our fatalities to an absolute minimum in this province, and it has kept our infection rate in the vast majority of communities in this province to a minimum. The second thing I think about is people that have lost their jobs due to our response to this pandemic. And how are we going to provide them the opportunity to get back to work? We have had many weeks now where all levels of government have been paying people to stay at home. And it's time now to start shifting our thinking as to how are we going to create the opportunity for us to pay people to get back to work, back to either the work they were doing or something else in our community and in our economy. And now we have the challenge of doing that 71,000 times over to get everyone that has lost their job the opportunity to regain that job. This is not a binary choice, as I said in my opening comments, that we don't have to pick reopening the economy or flattening the COVID-19 curve. We can do both, and we've proved that with 500,000 people that are working in our communities all through the last number of weeks, when we have been able to flatten the curve time and time again in community after community and in facility after facility. And as the world looks to recover, we should view this as an opportunity. In Saskatchewan, we create our wealth through providing goods to the rest of the world. And we have in this province what the world needs to have a strong economic recovery. and most importantly, among the potash and among the uranium and among the agricultural goods that are going in the ground right now as we start the great mega project of seeding here in Saskatchewan, we have one of the most important resources, and that is the resiliency of the people in our communities across this great province. And I'm confident that we are going to not only be able to get our 71,000 people back to work in this province, but we are going to be able to go far, far better than that. And I would just close with this today, with Mother's Day being this weekend. It's going to look very different this year. It's going to look very different for all of us. We are going to be wishing our mothers the very best quite often in an extended household fashion, which I hope many of you are able to do and able to spend some time with your mom. But many are going to be wishing their mothers and the mothers of their children a happy Mother's Day through the telephone or through FaceTime or through a glass window if they're in a long-term care facility or something of that nature. And myself, like many others, will not be spending this Mother's Day with my mom or the mother of my children. And I would take this very selfish opportunity to wish both of them a very happy Mother's Day. And to the rest of the mothers in this province, I would just say thank you. Thank you for all you do.
Thanks very much for joining us today, everyone. That concludes our time.